healthy budgie is a constant generator of noise. Whether they are moving through wild flocks of thousands or sitting on a perch in your living room, they exist in a baseline of chirps, chatter, and whistles. This acoustic output is their primary survival tool. It is how they locate their flock, bond with mates, and express their state of mind. Sound is the primary window into their health. But budgies are also prey animals, and their biology demands they mask any sign of weakness. To show pain is to invite a predator's attention, so they have evolved to hide their distress until it becomes impossible to contain. For owners, this creates a phenomenon of auditory blindness. Because you hear their chatter every single day, your brain eventually filters the sound into the background, making it difficult to detect the tiny, subtle changes that signal a crisis. This constant wall of noise creates a deceptive sense of security, often masking the one specific sound that indicates your bird is in danger. The first and most critical anomaly is a sudden, uncharacteristic shift into total silence. This happens because the bird has reached a limit. They are redirecting every available calorie of energy toward basic organ function and survival, leaving no resources left for vocalization. For a creature biologically wired for constant communication, absolute silence indicates a severe physiological crisis. The click is a small, wet, rhythmic sound that occurs in perfect synchronization with every breath. It lacks the dry, playful quality of a bird tapping its beak against a toy or a perch. This sound is mechanical. As this diagram of the respiratory tract shows, mucus and inflammation have begun to block the airway. The click is the audible result of the bird forcing air through a passage that is no longer clear. This sound is particularly dangerous because it often happens when the bird's head is down while eating or at night while the house is quiet, allowing it to go undetected for days. As the respiratory distress escalates, the click often transforms into a wheeze. The mechanics here are even more severe. The delicate airway is now squeezed and narrowed by inflammation. Every breath is forced through a passage becoming too small to sustain life. This is a genuine medical emergency. Without immediate intervention, a wheezing budgie can die within hours. These subtle sounds represent a bird actively struggling to breathe, and they absolutely require an immediate veterinary response. The rasp occurs when a familiar daily chirp loses its clarity. If your budgie's voice sounds rougher, quieter, or like something is catching in their throat, they are in trouble. This indicates a respiratory infection or intense internal pain has affected the vocal box itself, making even simple communication a physical strain. Then there is the scream, a sharp, sudden burst of panic that occurs without any external trigger in the room. This happens when internal pain reaches a breaking point. The intensity of what the bird is feeling has completely overridden the deep-seated prey instinct to remain inconspicuous. You may also hear the trembling call. It is a small, shaky vocalization that can easily be mistaken for simple sleepiness or the bird feeling a bit cold. This sound marks an organism entering systemic shock. It is the sound of a body's internal systems struggling to maintain their function. When pain finally forces a budgie to break its silence, the resulting sounds represent the final signals of a failing biological system. To accurately assess your bird, you must pair these auditory signals with their physical context. If you hear an anomaly, look for supporting evidence. Check for puffed feathers, a bird sitting unusually low on their perch, or labored breathing with an open mouth. An unusual sound on its own warrants immediate and careful observation. However, when an anomalous sound occurs alongside these physical changes, the situation has escalated into a confirmed emergency. At this stage, your budgie is using every available channel to signal that they need life-saving help. Spend 5 uninterrupted minutes sitting right next to your bird. Listen specifically for what is happening underneath their normal chatter, searching for any click, rasp, or trembling note. Recognizing one small hidden signal is often the only way to intervene before the window for treatment closes. While sounds provide a window into physical health, behavior reveals their mental state. In our next video, we examine a common, seemingly happy habit that is actually a sign of deep psychological stress. Understanding your bird requires looking past the baseline of daily noise to hear the hidden language of their survival.